although our primary endpoint was a co-primary toxicity outcome, but the secondary endpoints were the survival outcomes, including biochemical failure-free survival, overall survival, metastasis-free survival, which are very important outcomes. And what we have shown is that for all the survival outcomes, the standard fractionation and the hypofractionation arms, they were pretty much superimposable, meaning that there was no difference at 7 years or any time points that you can assess. There were no difference with respect to a standard fractionation versus a hypofractionation. And we did the analysis at 3 years after randomization, at 5 years after randomization, and at 7 years after randomization. All those did not show any difference vis-a-vis the metastasis-free survival, the biochemical failure-free survival, or overall survival, especially prostate cancer-specific mortality. And one thing I want to emphasize that the results were pretty good. At 7 years, the biochemical failure was over 80%, and the prostate cancer mortality over 90%. So these results were very encouraging. I think we do conclude that at 7 years, there was no difference between a standard versus moderate hypofractionation for patients for high-risk prostate cancer patients who are planning to receive external beam radiation therapy.